musculoskeletal examination of your adolescent patient really begins when they first walk through the door. You're looking again at their movements. Are they jerky? Are they coordinated? How is their gait? Do they have any limps? Are they walking appropriately? Are you noticing anything out of the ordinary in that patient's movements? You will visit with the patient. Kennedy, have you had any sports-related injuries? Nope. Have you had any broken bones?
Yes.
What bone have you broken?
My elbow and my finger.
How long ago were those injuries?
About a year or two ago.
Did you have surgery on either of those?
No.
No? Okay. And everything healed up okay? You got full function of all of those?
Yep.
Have you ever had any sprains or any torn ligaments or other injuries like that?
No.
Okay. So once you visit with the patient and kind of get their history as far as musculoskeletal goes, there's several examinations you can do. You want to check joint movement, range of motion movements, and as many of those joints as you can. Let's see here, Kennedy, we're going to start with this leg, and I'll just have you raise it up for me. Okay, and we're going to have you bring that out. You want to test adduction and abduction of your hips. And then as well as your knee joints, you want to make sure they're working. Check range of motion for the flexion and extension of the ankles. Kennedy, I'm going to have you press against me with your foot here. Okay, you want to test to make sure that the patient is able to push against you, that they can handle resistance movements as well. And again, for the sake of the length of the video, we'll just do one side range of motions here. Okay, and same with your shoulders. Kennedy, if you have any pain, let me know. We want to make sure that the shoulder joint is freely moving. The elbow is freely moving, and that wrists are freely moving. Okay. Kennedy, I'll let you sit up and dangle your feet over the edge of the table. In addition, you also want to check range of motion of the neck. Kennedy, I'll have you put your right ear to your right shoulder.
You're right.
Your left ear to your left shoulder. Can you touch your chin to your chest? And then look up for me. Any pain, clicking, or popping in your neck with any of that?
No.
Okay. And then you also may want to check range of motion with your patient standing up. In addition, you want to check scoliosis screening for the adolescent population is very important. Let's move that back. Get that picture. I'll have you take a step back. You can have your patient turn to the side and have them bend over. You want to check and make sure that the spine is well-rounded. You want to make sure that it is straight, that there's no bends or curves in the spinal column while the patient is bent over. And obviously you want to do it while the patient is undressed so you can get a really good look at their spine.